Have you ever felt a sharp pain in your lower back that suddenly shoots down your leg, making every step uncomfortable? Maybe it started as a dull ache after gardening, lifting groceries, or simply getting out of bed. At first, you assumed it would disappear in a day or two, but instead the pain spread. Your leg began to feel heavy. Your foot started tingling. Perhaps your toes even felt numb. If that sounds familiar, don't ignore it. What many people don't realize is that pain in the leg isn't always caused by a problem in the leg itself. In many cases, the real source is hidden deep in the lower back, where one of the body's largest nerves begins its journey. When this nerve becomes irritated or compressed, the symptoms can appear far away from the actual problem, making it easy to misunderstand what's really happening. This is why so many people spend weeks or even months treating the wrong area. They massage the calf that hurts, apply pain creams to the knee, or rest the foot that's tingling. While these approaches may offer temporary comfort, they often fail to address the underlying cause if the nerve itself is under pressure. The encouraging news is that your body usually gives warning signs long before the problem becomes serious. Learning to recognize these signals early can help you seek the right medical advice, reduce the risk of long-term nerve damage, and stay active as you age. Today, we'll walk through exactly how this important nerve works, why pain often travels down one leg instead of staying in your back, the most common reasons this happens, and the warning signs that should never be ignored. We'll also discuss when simple home care may be reasonable, and when it's important to speak with a healthcare professional as soon as possible. Before we continue, remember that this video is designed to educate, not to diagnose or replace professional medical care. Every person's situation is unique, and persistent or worsening symptoms should always be evaluated by a qualified healthcare provider. So, what is this nerve that's responsible for so many different symptoms? It's called the sciatic nerve, and it's the largest nerve in the human body. Imagine it as a powerful communication highway that carries messages between your brain and much of your lower body. It begins in the lower spine, where several nerve roots join together to form one thick nerve. From there, it passes through the buttock, travels down the back of the thigh, and continues toward the calf, ankle, and foot. Because this single nerve supplies sensation and movement to so much of the leg, even a small amount of pressure near its origin can create pain, tingling, numbness, or weakness almost anywhere along its path. That's why understanding where symptoms begin and how they spread is often the first clue to identifying what's really going on. One of the most common reasons is a problem involving the discs between the bones of your spine. These soft, cushion-like structures act as shock absorbers every time you walk, bend, or lift something. As we age, these discs naturally lose some of their flexibility and moisture. Sometimes they begin to bulge or tear, placing pressure on nearby nerve roots that eventually form the sciatic nerve. But a bulging disc isn't the only possible cause. Age-related narrowing of the spinal canal, known as spinal stenosis, arthritis in the lower back or hips, muscle tightness, or even prolonged poor posture, can all contribute to irritation of the nerve. That's why two people can experience similar leg pain for completely different reasons. The symptoms often follow a recognizable pattern. Pain usually starts in the lower back or buttock before traveling down the back of one leg. Some people describe it as burning, while others say it feels like an electric shock. Tingling or pins and needles may develop in the calf, foot, or toes. Over time, the affected leg may begin to feel unusually heavy or weak, making it harder to climb stairs, walk long distances, or maintain balance. While pain is often the symptom people notice first, weakness deserves even more attention. If your foot begins to drag, your leg repeatedly gives way, or you find it difficult to stand on your toes or heels, these changes may suggest that the nerve is no longer sending signals to your muscles effectively. Those symptoms should be evaluated promptly by a healthcare professional. There are also certain warning signs that require immediate medical attention. If back and leg pain are suddenly accompanied by loss of bladder or bowel control, difficulty urinating, numbness around the groin or inner thighs, or weakness affecting both legs, don't wait to see if the symptoms improve. These can be signs of a rare but serious medical emergency that requires urgent evaluation. The good news is that most cases improve without surgery. Treatment often begins with a careful medical examination to identify the underlying cause. Depending on your symptoms, Your healthcare provider may recommend physical therapy, specific exercises, short-term medication to reduce inflammation, lifestyle changes, or in some situations, imaging such as an MRI to better understand what's happening inside the spine. Perhaps the most important lesson is this: don't simply chase the pain. Instead, focus on finding the reason it's happening. Pain creams and temporary remedies may ease discomfort for a short time, but lasting improvement usually comes from treating the source of the problem and supporting your spine through regular movement, healthy posture, core strengthening, and maintaining a healthy body weight. Remember, occasional back discomfort can be common as we age, but persistent pain that travels down the leg, especially when combined with numbness or weakness, should never be dismissed as just getting older. Your body is trying to tell you something, and listening early may help prevent more serious problems later. If you found this video helpful, consider subscribing to Dr. Mark Plus for more evidence-based health information designed to help you stay active, independent, and healthy for years to come. And let us know in the comments, have you ever experienced back pain that traveled down your leg, and what helped you manage it?